if we focus on a conversation around a gap analysis around the first generic CIP, which I think people find most challenging, which essentially is the able to function within an NHS organisation and management systems. And so if we just focus on that particular one and we do a gap analysis process through there. So where do you feel you are with respects to that particular CIP, and where do you think you can progress, and where do you think the gaps are within that particular capability in practice is or are?
Sure. So for this sort of particular SIP, which is focused on sort of leadership management, I suppose, I had the sort of good fortune of having sort of completed a sort of leadership year out of program a few years ago. So I think in some respects I've probably got a reasonable amount of insight into this. But I did sort of reflect and sort of realize and decide that actually there were certain sort of tasks that I would need to be sort of versed in as a consultant, certainly, a
Mhm.
first year consultant, that I hadn't really had much exposure to. And those things included things like how to deal with a patient complaint, or sort of contributing to sort of putting forward a business case for a new service. These were two specific sort of points that I wanted to try to sort of get a bit more sort of experience in. And I flagged that to my educational supervisor. And so we did set myself sort of a task, a challenge, that over the year, under their supervision, I would try to address a patient complaint that had come to the ward. And so that's something that I'm working on.
So essentially, you'd uh, understood that you have a huge amount of knowledge within the management structure of the organization, but there's some very specific and regular instances which you hadn't actually encountered because you personally hadn't been involved, luckily for you, within a specific with a complaint, and so you wanted to indulge in that particular skill set and enhance your skills within that particular environment and make sure that you close off the loop with respect to the knowledge for dealing with complaints was the first thing, wasn't it? And so,
That's right. Yeah.
essentially, what we've done is it created a gap analysis for that particular thing. So then, over the course of the year, you could focus on that particular aspect of things. Um, with respect to business cases, again, it is probably something that the service leads spend more time doing than others. And if that's something that you want to indulge in and increase your proficiency in, which is absolutely definitely the right way forward, then focusing on that as well is important. I think it's always important to make sure that you do something that's achievable, and so deciding on one rather than the other maybe the way forward. But it all depends on what the gap is, and that's a conversation that incrementally works its way through over the course of all the educational supervisor meetings we'll have over the course of the year. And if we find that the gap in complaints is bigger than we thought, then we concentrate on that. If it's actually quite small, then focus on the business cases and also the latter thing. So if the gap in business cases is huge and it is something that you're getting to the end of your training, so you're going to CCT, then it becomes a little bit more important. But looking back on the fact that complaints are also important and potentially are things that you want to deal with much more robustly is a conversation they have going forward. Can you see this being used with all the other generic CIPs as well?
I think so, yeah. I mean, I think probably the other thing to sort of reiterate is a lot of what I do on a day-to-day basis as sort of a respiratory registrar, GIM registrar.
Mhm.
A lot of the sort of routine tasks also fulfill several of the sort of generic CIPs as well. It's sort of easy to forget that. But, even just the simple task of leading a ward round, teaching juniors on the ward round, liaising with sort of my sort of bed managers to get admissions or discharging patients at the front door, things like that do fulfill many of the generic SIPs as well, and it's easy to sort of forget that. And of course, some of these sort of more clinical sort of based activities, I think you can evidence quite adequately with things like ACATs and CBDs, but certainly some of the more targeted activities, like for example, the sort of experience of dealing with a patient complaint, won't really be sort of adequately captured by an ACAT or a CBD. And I think for those types of
Mhm.
activities, a reflective log is probably the way to try and document and capture some evidence. But yeah.
I think you captured it nicely, is in the sense that if we knew on the very first initial meeting that there was a understanding that all of the CIPs could be captured in that sort of way, we've got a shared approach to be able to fulfill all the generic CIPs. And I think it's always it's a shared road, isn't it? That's always easier to follow, especially when the destination is exactly the same and is understood by both.
Yeah.
So thank you very much.
Thanks a lot, Vinay.